Hello everyone. Today we'll talk about something that has been asked a lot. Last 3 months, I shared a few results of Sana, of Arzu, and a lot of people started asking, what is it that I've done? This is what I would like to call Dr. Salman signature non-surgical facelift. I call it signature facelift because it's completely unique for every patient. We have discussed Botox, you know about fillers, you know about HIFU, you know about microneedlings, you know about all non-surgical types of facelifts. But the signature is actually a combination of all of these. Every patient is different. I might use 1 ml of a filler in one patient, I might use 5 ml in another. I might use 40 units of Botox in one patient and I might use 80 in another. I might use 3 pairs of threads in one patient and I might use 5 or 6 pairs in another. The signature lift is a combination of all of these. Every face is different and every face has to be dealt with in its most exclusive, its own identity that has to be maintained. Whatever I do in the signature lift, overall the patient looks good, happy, younger, fresh, youthful, and a younger version of himself. If he's 35, he's going to look less than 30. If he's 40, he's going to look less than 35. If he's 50, he's going to look less than 45. That's how the signature lift works. My most important aim in the signature lift is to make it completely natural so that people see you and they say, you look young, you look healthy, you look better. But they should not know what have you done, whether that is Botox, whether that's filler, whether that's threads. So a combination of all this, I call it Dr. Salman's signature non-surgical facelift. Book your consultations with my team and you'll be able to know what you require, what you desire, and how to feel young. And the best part about this non-surgical signature lift, it's anti-aging. Whether you use Botox, whether you use filler, whether you use threads, whether I use microneedlings, whether I use HIFU, all of them are anti-aging. Couple that with your good skincare routine and you would remain young for a longer period of time. Since I'm a plastic surgeon, I'm able to do surgical facelifts. I do them very, very frequently. So when a patient comes to me, I look at everything from the hairline down to the chin and neck. And then I decide whether this patient should go for the non-surgical lift or the surgical lift. If non-surgical, then what does he require? Which modalities would work best for him? How long would those modalities work? And when would I plan the surgical lift? Normally, I like to plan the surgical facelift after the age of 45 to 50, unless and until someone has gained and lost a lot of weight. So the surgeon that you pick or the physician that you pick, I believe it should be someone who has a good command on each and every step that is included in the stair of aesthetics. If someone is good with non-surgical only, that person is going to recommend only non-surgical treatments. But if someone is good with surgery as well as non-surgical, he is going to tell you what precisely is good for you. What is anti-aging? When do we do threads? How long would they last? When do we plan for a surgical facelift? For example, I have patients who have been doing PRPs for hair in my clinic since 2019, and then they got hair transplants at my clinic in 2025. Similarly, I have patients who did threads and fillers and Botox, one or another, for many years, and now they are actually candidates for surgical facelift, either smash lift or deep plane lift. So this is how you should plan your aesthetic journey. You should look graceful when you age. You should not make uh, a laughable instrument of yourself by picking someone who's doing things cheaper, someone who's doing things that are not particularly suited. Because the most important point when I have a filler injection, and whenever I teach, I always tell people the most important point is when to stop. It's not that if you have money and you can buy a lot of fillers, you get them all into your face. No, you need the precise amount. How much, where, which type of filler, which areas, all of this combined with threads, Botox, HIFU, microneedlings, skincare, together that's going to make the best out of you. So in order to book your appointments, stay in touch with my team. Whatever questions that you have, drop them in comments. I'll be happy to answer them. Take good care of yourself, stay young, stay healthy, and stay confident.